One thing I learned from the video titled Public Health Nursing, Changing Lives and Communities about public health nursing is the vital part that the profession plays in reaching the community on a personal and relatable level. One of the interviewees in the video mentioned liking the maternal and child health public health nurse because she approached her clients in a family-like manner. This provides her clients with a feeling of trust and relief. This is extremely important in healthcare because we often see people withhold information or avoid seeking the necessary care that they need because they do not trust their healthcare providers or the healthcare system in general. It is extremely important that clients have healthcare providers that they can relate to and who they feel comfortable confiding in. According to a study titled The Nurse-Patient Relationship as a Story of Health Enhancement in Community Care, a meta-ethnography, researchers write, quote, "Trust emerges as a core characteristic of the nurse-patient relationship, and findings show that trust is closely linked to open communication, personal sharing, and intimacy. Many nurse-patient relationships evolve into professional friendships, but in addition to patients being able to speak freely, they can also expect to get help as needed. The nurse-patient relationship helps nurses understand how to motivate patients in self-care and indicate that they are more receptive to teaching and likely to follow the advice of nurses they find trustworthy," unquote. This shows us the direct impact that a positive nurse-patient relationship can have on the health outcomes of clients. Clients should desire to seek the help that they need and be able to lean on the healthcare system. This starts with having healthcare providers that clients feel who they can relate to and who treats them as a human being. This video gave me a different perspective about public health nursing since we often discuss the profession in isolation of direct patient care. However, public health nurses play an essential part in bettering the community and its residents. This course was extremely relevant in my consideration of eventually pursuing community health nursing. My love for my community back home in Baltimore City and witnessing the unmet healthcare needs of minority and vulnerable populations within that community is what motivated me to pursue nursing in the first place. I wanted to, and still plan to, contribute to achieving health equity and making good quality healthcare accessible to everyone. As I have navigated my journey through nursing school, I knew I wanted to start my career at the bedside, but ultimately knew that I would be doing my community a disservice if I didn't extend my expertise beyond that. I want to use my role and platform to work more closely with the community that I love and create resources that decrease the barriers of care that they are experiencing and the current flaws in the Baltimore City healthcare system. Before taking this course, I believed this would be achieved by pursuing public health nursing. However, this course quickly taught me that community health nursing was the area that I was looking for. According to our course textbook titled Public Health Nursing, 10th edition, authors write, quote, "Thus nurses providing secondary or tertiary care in a home setting, school nurses, and nurses in clinic settings. In fact, any nurses who does not practice in an institutional setting could fall into the category of community health nurse," unquote. I aspire to keep my community at the forefront of the work I complete during my nursing career. From one to complete school nursing for a few years, to my hopes of opening a clinic and resourcing it in Baltimore City for underserved communities, pouring back into my community that has poured into me is my main goal. The course reassured me of that passion and gave me insight into what the community health nurse profession consists of. The impact of the community health nursing course on my life as a person residing in my community is the different perspectives that the course has given me when observing my community. Both living in DC and living in Baltimore, I noticed different aspects of my communities, but not in the way that I do now. After experiencing the course and completing assignments such as the windshield survey, I now take my community in through a whole new lens. I am much more observant when it comes to infrastructure, safety, resources, greenery, upkeep, population demographics, and more. I also find myself taking notes of areas of improvement and things that are working well for my communities. This newfound lens inspires me to want to be more involved in my communities, especially when it comes to advocating for necessary changes. As residents in our communities, we have the power to shape our community into what we want it and need it to be for ourselves, each other, and those who come after us. If we do not advocate for ourselves, then we may not receive the improvements that we need. Another impact that the community health nursing course has had on my life as a person residing in my community is the reinforcement of the prevalence of inequity and social determinants of health. As each group presented the wards in DC, it was hard to overlook the blatant correlation between wealth and access to needed resources. It was disheartening to see the lack of access to produce, healthcare, and decent living situations in certain wards, and how your income impacts your access to basic necessities. This made me look closer into my own community back home in Baltimore City, and through my research, I found that, according to health.baltimorecity.gov, cardiovascular disease and cancer are the leading causes of death in the neighborhood that I grew up in. There are not many healthcare resources, in any, within that neighborhood, which makes me wonder how many of these deaths could have been prevented. This course makes me want to continue exploring my communities in depth and determine ways in which I can contribute to positive changes being made. I hope that future nursing students will gain a new perspective of the nursing field after taking this course. Many people enter the nursing profession for reasons such as money or desire for a certain lifestyle. However, there is so much that can be done with a nursing degree and license. We are about to be equipped with the power to change and save lives. I hope that future nursing students will feel inspired to take full advantage of being able to get involved in their communities and utilize their platforms to leave a lasting impact. Whether they decide to stay at the bedside, continue their education, and attack inequity at a different level, or even transition into policy, I hope that students will come out of this course understanding how much our communities need passionate nurses, especially those that look like us. Although we may not be able to, and probably will not, be able to see all of the necessary changes in our lifetime, we can use our roles to help healthcare move in the right direction. This class has been a great experience, and I hope that it can spark a light in future students the way that it did me.